gonna do what we can. We're talking about the right way of using over-the-counter medication. The right way of using over-the-counter medication. Let's see the right way of using over-the-counter medication. What is the right way of using over-the-counter medication? If you are coming in right now, welcome to the channel. Welcome to the channel and welcome everyone who is watching. If you are a new person, check out the channel, the kind of work we do. We discuss medical work here, medical tips to make you healthy every time. Go to the channel and subscribe to the channel. Follow what we are doing. It may be helpful to you, or you may give some tips to someone that may be helpful. So today we have been talking about over-the-counter medicine, and we have seen we have so many tips when it comes to over-the-counter medication. You just don't go buy drugs over the counter, and then you are there taking the drugs without any. Ridley, big up Dr. Benjamin and family. Big up Ridley. Thank you for tuning in. Today I've come so late, but we're gonna do something. We're gonna do something here. Now, over-the-counter medication is the medicine that you go and you buy to a retail shop or somewhere without any prescription from a licensed doctor. Remember, I've said a licensed doctor. And after we have done everything that we have done, we want to check the right way of using this medicine, because you cannot just buy drugs over the counter and then you use them without reading the labels well, reading whatever that you have been given in the right way. You see, so over-the-counter medication is very important because it helps you reduce the symptoms. But what is the right way of using this medicine? Do you just take the medication and then you start using anyhow? So welcome everyone who is coming in right now. Rule George, welcome. Hi Benjamin, bro. Do you remember me? Yes, I do. Shraddha, hi, welcome to as you come, you like, so that when you like, other people are notified. In Patch live we had meet in Pancha Nathan. In Pancha, yes. How was your day? I'm fine. So today I'm just coming to discuss what we have been talking about before we start another session. I can see Rule George is in the house saying, help sir. Which one? Help. How can we help Rule? Rule, have you subscribed to the channel? Nice to meet you, doctor. Welcome, Shraj. Your name, what is the shortest way I can call your name? The shortest way I can call your name. Is it Shra? I'll call you Shra. Shra, welcome to the channel. If you have a question, you can send a request. You come live, we talk, we ask any question. So everyone who is coming, man, this is Dr. Ben Anand. Hi. My biggest supporter is in the house. Anand, Rule George, work visa. Which country are you from? You need help for work visa. You subscribe to the channel, leave me a message, then we gotta interact. Good evening. I'm fine, Arul. I'm fine. Today I'm just talking about random topics over the counter medication. Those people that like going over the counter, the right way of using those medication. Like Dan, thanks for hitting me up and liking the video. So today, if you have a chance, you can go send a request then you come live with me. You know, if you have a super comment super live. Thank you, Ananda, thank you so much. I know you are my biggest supporter, and I thank you for that. A big up from India man. So if today you want to talk to me, everyone, come on the live with me, send a request, and I will accept, and then we talk. So the right way of using this medication of over the counter, you don't have a prescription, even any other medication, always read the information and the package before taking the medicine. The label tells you the name, strength, indication, dosage, frequency, warning, and possible side effects, and the side effects that you may get, so that if you have a side effect that may be bad, so bad that you can stop taking that medication. Now, the other thing is know the active ingredients. And thank you for the love. Know the active ingredients. Check the substance actually produce the therapeutic effect. This helps prevent taking two different products that contain the same active compound. Yes, we talked about that. In the US, paracetamol, most of the products are written acetaminophen. Here in Kenya, mostly it is written paracetamol. And then you go and buy paracetamol, and then your friend has acetaminophen. If the brand that is written paracetamol is not working, what do? You go on and buy something that is called you take acetaminophen. You have taken the same thing. So check with the substance actually produce the therapeutic effect. If it is paracetamol, check it. Don't take the same thing with different names. It's different company names. You take the same thing that is produced by different company, but the compound is the same. So that is very important. Yes, several cold and flu products may contain paracetamol. So you have taken a flu product that has paracetamol, then you go and buy another one because this one has not worked, that has Piriton, and it doesn't have aspirin. You take it, you are taking the same thing, double dosing. You see, double dosing. It is very important to check. Take the correct dose. Use only recommended amount. If it is 1 gram, use 1 gram. See, don't take a lot of, because you want to get better. If you are not taking over-the-counter medication and you're not getting better, what do? You go and see a doctor. So everyone who is coming in, welcome everyone. Thank you for support. And if you are a new person, you know what to do. Hit the like button and also subscribe to the channel. Let's go. Take correct dosage. Dosage is very important, and I said it's very important because dosage, when you are taking a medication, it has gone through some tests, quality tests. So thank you, Anand, for your hit up 100. Thank you for that. It has undergone a standard check. It's called quality assurance. Me say thanks to Anand. It has undergone quality assurance, and this quality assurance means it has undergone therapeutic index check, bioavailability, pharmacokinetism. Therapeutic index means in a simple way I can say the percentage of how this drug can kill you or can bring toxicity to your body. Pharmacokinetism and pharmacodynamism, how this drug is working on your body and how your body responds to the drug. All these things are taken care of. Half-life of the drug in your body. They have taken all this care of all these things, So you are advised when you are taking medication, don't take above the recommended dosage if it is over the counter, because you may bring problems to yourself. Why? those things that are taken care of, and sometimes you go to a hospital and then you are told, check the weight. We also consider the weight of the drug that you are taking. So read the medicine label correctly, know the active ingredient, take the correct dosage. Very important. Take the correct dosage. This is very important. Follow the frequency, the correct way of taking, because even when you are going to the outlet of drugs and then they are asking you how the symptoms, they have the frequency. If it is taken 2 days, if it is taken 3 days, if it is taken 1 day or twice a day, those are the frequencies. Like most of paracetamols are taken thrice a day or twice a day according to the problem that you are facing. Do not exceed maximum daily dose. If you have been given a drug for it's given 1 gram, it's given 1 gram. Please take the 1 gram. If symptoms are persisting and you are feeling so, you have a headache that is not going down, what do? Go and check a doctor. Tell the doctor, I bought these drugs but my symptoms are not coming back. So welcome my friends, all that are watching, everyone that is on the platform. Big up yourself for what you are doing. All support and come to the chat. Tell us you are watching from Kenya, you are watching from Africa, which part? You are watching from the US, you are watching from Asia. Tell us our friends where you are watching from. Aman D7 and 8. Hi brother. Aman, I'm fine. Hope you are good. I'm talking about over the counter. Hope you have liked the stream and also subscribed. I know you are my subscriber, man. Big up yourself. Welcome. You see, our friend Ananda is in the house, W79, and is doing a great job by supporting. So everyone who is coming, you are seeing the host is Dr. Ben doing his thing and also going on and on supporting good health. So if you are watching me from Mombasa, Aman is from Mombasa, Kenya. Aman, big up yourself. Hit the like button. Let's increase the like so that many people can get the impression. That's cool. I am from Nairobi. You see, we are in the same country. Yeah, and some others are far away. So welcome everyone. Welcome. If you have a question, any medical question, don't fail to ask. Just hit me, ask that medical question. And if you feel you want to come live with me, go to the post, send a link. You come ask me a question on a live. We talk, we discuss. Or you want to say hi on a live, just send it. So let's continue. Where are you from? I'm from Nairobi. I am from Nairobi, Kenya. The same country that you are in. So yeah, everyone who is coming and you are a new person, you bro, everyone that is coming and you are a new person, please come in and interact with others, please, and hit the like button. How old are you? I'm old. I'm over 30 years. I am over 30 years. You see, I'm over 30 years. So I've worked as a doctor for some time. You see, my face is over 30 years. So do not exceed the maximum daily dose. Yes? Do not exceed the maximum daily dose that you are required to take. Very important. Take dosage that is required. If the maximum dose is achieved and you are not feeling better, go to the doctor. Let the doctor advise you. And also, there is a very important thing that you need to check. Very important thing that you need to check when taking medicine. Very important thing that you need to check when taking medicine. Expiry date. You know, some products, when they expire, they may not be effective. Some products, when they expire, they may not be effective. Some products, when they expire, they may be toxic. They may bring bad issues to your. So it is two-way. As we talk, if you have a question, you ask. So expired products may be two-way. Check the expiry date. You may take a product that has expired. One, it may bring bad effects to your body. Toxicity. 2, there are some products that even if you take them when they are expired, they will not harm you, but they will not be effective. So you'll just be taking an expired product and you are not feeling better. Or you take the expired product and it does bad things to your body. So check the expired drugs correctly. Check the dates. Check the expiry dates. Measure liquid medicine. My friend Jack Sparrow is in the house. Jack Sparrow. Hey. Jack Sparrow, you've gone for so long. What's up? What's up, man? What's up? We have Aman, we have Ananda, we have Jack Sparrow in the house. We have Shrad. We have Shrad. So, my friends, I'm just talking about when you are feeling headache, you are feeling bad stomach, or something is itching. Mr. Benjamin, how are you? I am fine. Fiona, hey, there was a time you were so on a live so late, working so hard. That is a good thing, Fiona. Fiona, hello everyone and the chat. We are fine, Fiona. We are very fine. We are very fine. Fiona is from Uganda. A lady from Uganda, nice lady from Uganda. Big up yourself, Fiona. Welcome. Like, my friends. If a person is a new person to my channel, let's introduce that person in a good way. So, Jack Sparrow, how have you been? You see, today Ananda is here, and our friends Aman and our sister, all of them are here. Jamaican uncle in the house. Blessings to you, Benjamin, the wise guy. Thanks a lot, Jamaican uncle, always supporting and taking your time to support these streams. You know, sometimes supporting a stream is not a joke, because Jamaican uncle never misses my stream. He's always here working hard and always supporting. Thank you, Jamaican uncle, for your support. Jack Sparrow, I'm good, dear. Jack Sparrow, hope you are good, Jack Sparrow. Hope, Jack Sparrow, you are doing good. So today, if you feel like you can come to the live and talk to me and we interact, it is open. You can send a link and then we interact. Ananda is in the house. Ananda, my biggest supporter, is in the house. Jamaican uncle is in the house. So ask my friend a question that you would love to ask. So everyone who is here, Fiona, I saw your YouTube stream. Yes, Fiona has a channel. Fiona has a good channel, and the good channel of Fiona is doing marvelous. So you can support Fiona, everyone, as we interact. If you are a new person and you're watching from the background, don't shy away. Just come to the chat and let's communicate. Yes, so we were talking about expired product. When you're going over the counter, Ananda always supporting me. Ananda always supporting me, giving me some tea as I talk. Ananda, thank you so much for your support. I appreciate it. It's not for granted. And may wherever that is coming from, come and be more and more and more. Thanks everyone who is supporting the channel. Yes, thanks everyone. Let me say thanks. Thanks. And everyone who is watching and sharing everyone who is watching and supporting my live and sharing to the people. All of you great people, I say thanks. Where is Panther? Someone to tell Panther I'm live today. I have not seen Panther for some time. Jack Sparrow, text Panther, tell Panther I'm alive. I want to talk to him. I want to talk to Panther. Ananda, thanks so much. So let's get going, my dear friends. Let's get going. So expired medicine is very bad. Expired medicine can be two-way. Cannot harm you but not will be effective. 2, it can harm you. It depends with the kind of drug that you have taken. If anyone who has Panther's, I know Jack Sparrow has Panther's number. Tell Panther I'm online. Anyone who has Panther's number, like Jack Sparrow, Ananda, everyone, tell Panther I'm online, please. Check the expiry date, that one we have talked about. Measure liquid medicine correctly. You know, sometimes people don't measure liquid medicine. You just take the like this one, you feel you take, and then you take because you feel it will not. The liquid medicine has dosage because that medicine has milligrams that you are supposed to be taking. That medicine has milligrams that you are supposed. Ananda invite Dan, welcome. Support Anand too. So that medicine has specific milligrams you are supposed to take, and you are taking more because you think it is milligrams. It is just fluid. You will end up taking excess of the drug that you are supposed to take. You see, so measure always, like use the measuring cup, spoon, or oral syringe supplied with the medicine. Because this liquid medicine, they are given some spoon cups like this one to measure, and they have calibration 5 ml, 10 ml. So you measure the liquid correctly. You see, household spoons and tables can give accurate dosage. So if it is 10 ml, we use the big spoon. If it is 5 ml, we use the small spoon. You see, so that you cannot take medicine wrongly. You see, those are the right ways of using the over-the-counter medicine. Yes. Avoid duplicate ingredients. Before taking more than one over-the-counter product, compare their active ingredients. I don't know how I will. Let me come with some drugs we compare. Yes. Now, these two drugs are paracetamol. Welcome, new guys. Welcome to the channel. Your support is appreciated. Thank you so much for those who are supporting. Now, these two drugs are paracetamol. You see, they are from different companies. Like Curamol and Tumol. These two drugs are from different kinds. If you're coming and you have not liked, hit the like button, my friends. Hit the like button. Let's get going. So you see, you don't look at the company name Curamol. You don't look at the company name Trumol. All these things are the same. They are paracetamol from the same company. So you check. Come to 5 minutes. Yes. Thank you. Anand, thank you for that. So you check the active ingredients. They have written here, each 5 ml teaspoon contains paracetamol 120. Contains paracetamol 120 milligrams. So this one also paracetamol 120 milligrams. That is what you are supposed to check. Don't check the brand. You see, this is Trumol and this one is called Curamol, but they contain the same thing. So that is what we are talking. Avoid duplicate medicine. You have gone over the counter, you have bought this, and then you see, it is not working faster. Go there, you go somewhere else. You find that this other active substance is not like this one. You buy this one. So you think you are doing different things. You are just taking the same thing. You see, and overdosing yourself. So get to understand several things that are important. Avoid duplicate ingredients like what I've just shown you. I can see more people coming in. Thank you so much for coming in. Hit the like button, my friend. Subscribe to the channel, my friends. Let's get this channel big and share this channel. Yeah, Jack Sparrow, are you still here? Jack Sparrow, if you are still here, tell Panther Pancha that I'm here. Tell Pancha that I'm around. Pancha always want to see me when I'm around. Tell Pancha that I'm around. Jack brother, thank you better. Okay, another. Okay, Jamaican uncle, thank you. Ananda, welcome, thank you. We've said avoid duplicate medicine. Check for drug interaction. You check the drugs if they are interacting. Check for drug interaction. What do I mean drug interaction? Some over-the-counter medicine can interact with prescription medicine, the over-the-counter medicine or supplements. So interaction means this. When you're taking over-the-counter medicine, you may take them, and the other drugs that you are taking, like for hypertension, like diuretics for hypertension, calcium channel blockers, they interact and then you don't feel the effect or they can be toxic, because interaction means I can see T-Beauty, it has been long. Hope you're doing good, T-Beauty. How is the US doing? How are you doing in the US? Hope you are doing good. Hope T-Beauty is doing good. So I was saying that the interaction may bring problems. Drug interaction come out with different kind of products because they are reacting and some bring crystals, some sublime to water, and then it's not effective. And maybe after, good, doing great. Thank you so much for that, T-Beauty. Thank you so much for that. So when they interact, what you get is a problem. Inactive ingredients or active ingredients that bring toxicity. A drug interaction means that what you are taking interacting with the other drug. Mario Pinto Souza, did you know what you can jump? Did you know that you can jump? Yes, I can jump and shout. Oh, Mario, as you come in, you subscribe to the channel and you hit the like button. Subscribe to the channel and hit the like button. So, okay, very important. T is laughing at my jumping and shouting. Now let's get on. Let's go. Tell the pharmacist about other medicines. Hi, Dr. Ben, the second wise guy. Who is the first wise guy? Tell me no. Tell me no, my colleague. Who is the first wise guy? Is it God or Jesus or who? Or someone around you? Yes, let's get on. So, drug interaction means you have taken a drug. You have taken, and you, of course, the three wise men. Who is the third? Yeah, you see that? I see that. Michael Len is saying he's the first. So we have this drug interaction problem. You mix a lot of drugs and they are not working, because you have seen one day when you use a certain drug alone, you feel the effect. But when you use with another one, it doesn't have any effect, because those two drugs, what they do, they interact. Those two drugs, they interact. We are talking about today. What are we talking about today? We are talking about the right way of using over-the-counter drugs. The drugs that you've gone over-the-counter and you have bought and you have not been given any prescription by the doctor. The right way to use them. You see? So tell the pharmacist about the medicines, how you are using them. Tell the pharmacist about the medicines that you are using, so that the pharmacist can advise you how to take. If you are a diabetic, tell the pharmacist. If you are hypertensive, tell the pharmacist. If you have an autoimmune disease and you are on drugs like arthritis, lupus, you tell the pharmacist, so that the pharmacist can know what to do towards you, which drug and what time can you take this one and that one. So T-Beauty, you are talking about the right way of using these drugs, the right way of using these drugs. Tell the pharmacist about the medicine that you are using. That is very important. You are already, if you don't tell the pharmacist, the pharmacist will not know the drug is giving you. Maybe someone took alcohol somewhere, a patient. You check a patient, and now let me check this. Eat clean, then you need other. The only time I'm sick is when someone irritates me. Yes, eat clean, then you won't need over the counter. Only time I'm sick when someone irritates me. Okay, I can see that beauty. Let me give you a story of one day. One day, someone took alcohol, and this person had some autoimmune disease. So the person goes, takes alcohol, reacts with the alcohol, comes with a swollen face, comes with a swollen lips, comes with, then the best way I can do is to reduce the swelling and give some medication and a prophylactic antibiotic so that this person cannot get infection when the swelling is residing. You're getting better. So when this person is at home, the alcohol that the person took reacted with the autoimmune disease that this person had, and I've given some drugs. So it was bad, went to be admitted, and the full face did all the tests, but everything was normal. The only thing that was bad is the burning effect. So they decided to say maybe the drugs I'm using or what, but the drugs were okay because even the referral hospital started with the same drugs that I gave. So this one was a big deal to this person because of interaction, alcohol interaction with the drugs that the alcohol interaction plus the problem that this person had. You see, so maybe this person was taking some other medication that the person saw this person before I saw the person, did not factor in the drug interaction. You see, tell the pharmacist about the other medicine that you are taking. Consider allergies. Do not take medicine if you have previous experience of allergic reaction. There are some people that have allergies. They have drug allergies, like which ones? There are some people that have drug allergies, like they are allergic to sulfur compounds. They have a protein in their body that is allergic to sulfur compounds. You see, so if you have an allergic to these compounds, you need not to hide. You need to tell the pharmacist, I'm taking this drug, but I have this allergy. Can include difficulty in breathing, facial swelling, the ones that I've told you, severe rash, which requires urgent medical. Allergic reaction can kill a person if it is not taken seriously. Do not take medicine if you have previous experience in allergy and you are not in hospital, you are at home. And some people, where they live, it is very far away. It is very far away from the hospital. So by the time you are getting the allergy and you are going to the hospital, you are being rushed here and there to be taken care of. The dust is done. You see, it is very important to take care of the allergy. That if you are buying over the counter, you tell the person over the counter that I have this allergy and I don't want to get this medicine. They'll get a substitute to what you will be better. Some don't say. They assume that maybe the person who is over the counter knows about the allergic reaction, which is very dangerous. You see, it is very dangerous to assume that a person who is over the counter knows the allergies, all the allergies. They don't know allergies. It is you personally who know. Allergies is you personally who know that I have this allergy, so I have not to take this drug and this drug. You see, so it is very important to consider all these things. To consider all these things. Let's get on. If you have a question, my friends, you don't keep quiet. You can even come live with me. There is a way people, if you are using a phone, you can come live with me by sending me a request I approve, so that you can ask me the questions that you have. Now, there is something called the allergies. That one we have talked about. Follow food instructions. Something that is very important. You are taking over-the-counter medication and you are taking some foods. You are taking over-the-counter medication and you are taking some foods that are not required. You see, I said some problems like allergies and let's say in which capacity. These ones that interact with some foods, they are very important, because the medication you don't take with some foods like tetracyclines, oral, the one tetracyclines that like doxycycline, ciprofloxacin. These are drugs that you don't take with compounds like milk, because they will interact and they will not be effective. They will interact and they won't be effective. So check this. It's very important. Don't take, ask the pharmacist which foods am I supposed to take and which ones I'm not supposed to take. You get? Arug is here. Why are you texting me 666? Arug. What is up with the 666? What's up with 666? So that is the way we check these things, very important. Don't just go home, take meat, take whatever you are taking, as you are not taking in consideration the interaction between food and the drug. Ask the pharmacist, can I take milk? Can I take meat? Can I eat greens with this? It is very important. Yeah? Some medicine should not be taken with certain types of foods. While others work best on an empty stomach, others work best by eating first before you take the food. The instructions are in the package, and the pharmacist that is distributing, the trained pharmacist or the pharmtech, knows. So you take them alongside the food, you take them alongside water. There are some drugs that you can only take them with water. There are some drugs that you can only take them with food. Let's give in consideration. You don't take drugs with sodas, fruit juices, because the instructions there have written carefully that take this drug with water. It is metabolized with water. There are some are metabolized with plasma protein. So that one they have another way of being given. Blessings everyone. Happy Tuesday. Happy Tuesday. Burnout to be blessed in the house. Big up every time, burnout. Very important. Food and drugs. We don't want food interaction. Yes, because once you do that, the drug that you are taking will not be effective. The drug that you are taking will not be effective. Be careful with alcohol. Those that take alcohol. Alcohol can increase the side effects of some medicine, particularly drowsiness, dizziness, stomach irritation, and liver injury with certain drugs. Alcohol. Taking alcohol with painkillers. Someone has gone to drink alcohol and is taking painkillers because this person has acidity. Some people even take antacids like omeprazole plus paracetamol, and you're taking alcohol. Then your liver starts to damage slowly and suffering. Take into consideration these things. They are very helpful. You as a layman or as a trained personnel, sometimes trained personnel are the ones who do the opposite because they think they are exceptional. They think they are exceptional. So everyone that is watching me, we are discussing about the right way of taking over-the-counter medication. The right way of taking over-the-counter medication. Be careful with alcohol. For those that are taking alcohol, be careful with this alcohol. Do not share medicine. Do not share a medicine. Because this kind of symptom relief or this kind of medicine did well to someone, you want to take the medicine you yourself and try it how it can work on you, or you think it will work better. I've said before a doctor gives medication, how many things that this doctor consider? There are several things before over-the-counter medication in a hospital or in a doctor setup. You are given medication. There are several things that are given. One, you consider what? Pharmacokinetism, pharmacodynamism, half-life, distribution, metabolism, and excretion. Imagine 6 things, including the dosage of what those are 7, not including the diagnosis. How this doctor came to the diagnosis and what is this doctor targeting with that drug. But you want to take the drug without the proper prescription. Because someone was well when he used the medicine, you want to take the same medicine. It will injure you. Don't share medicine. Never give out over-the-counter medicine to another person simply because their symptoms are similar to you. Their age, weight, allergies, medical condition, and other medicine may be different. You see, it may be, grape juice can be dangerous, yes, because of the interaction to other medication. Don't take grape juice with all the vitamins that they have and other medication. Remember, vitamins are highly synthesized and metabolized in the liver and excreted through the kidney, and you are adding another one that is interacting with the drug. So take medicine with water. If you are advised with water, take with water. You see, very important. You don't store medicine over the counter anyhow. You see, store over-the-counter medicine in a very safe environment. Taking care of your kids. Taking care of your kids. Because kids, if there are some medicine that are sweet. There are some medicines that are sweet. So when you take them, the children may feel that this one is something to regularly use. One day you will find your kid unconscious, not even ready to talk. Why? Because this person has used the wrong dosage by thinking it's something can be used irregularly. Keep medicine, all the medicine away from, keep all the medicine away from children. Some medicine somewhere children cannot place, store some medicine away where children cannot access. Some over-the-counter medicine can be serious and can poison children when taken accidentally. You get out. Very important. This is just a discussion, and let's discuss this one. Do not alter dosage forms unnecessarily. You are taking in the morning 20 milligrams, in the evening you are saying, let me add to be 3 milligrams. The efficacy, the efficiency of this drug will be altered. You are the one who will be getting damaged Good morning, doctor. How are you doing, guys? I'm just stopping in social support today, but I have to do a replay on this one. Also, I'm working, but I'm stopping to say hi to everyone. I'll see you. Good. Later, you guys. Thank you, Grandma of 3. Big up yourself. Thank you so much. We are talking about over-the-counter medicine. Over-the-counter medicine. Yeah, man. Grandma says, like that. Big up yourself, Grandma of 3. Do not use over-the-counter medicine for long. Do not use over-the-counter medicine for long. Do not crush, chew, split, or open a tablet or a capsule unless the instructions say so. Or the professional in the hospital has instructed and says, it is okay, you can take the capsule. You know, there are some people who open the capsule and it can be dangerous. Never open the capsule because you want effectiveness. Or you have a kid who cannot swallow a capsule, and you take the capsule, you open and you put the drug in water and you tell the kid to swallow. Never do that, my friends. Efasi Lipenga, the one and only mom to Tony Lipenga, my friends. You see that? And who was that? Was it Xavier Manu said, Tony Lipenga seems to be your sister. Big up every time, Efasi Lipenga. We are talking about the right usage of over-the-counter medication. Right usage. How do you use? You don't use that for long days over-the-counter medication. You don't. Why? Because they are only treating symptoms and the damage is getting bigger and bigger. Go to a hospital if you have used them for more than 3 days and the symptom is not improving. Go to a hospital. Go to a hospital. Over-the-counter medicine are generally intended for short-term self-treatment. If symptoms continue or repeatedly return, the underlying problem may require reassessment and then you are treated accordingly. You who is always going over the counter asking medication and the symptoms are not, you're just relieving the symptoms. Be careful, my friends. Be careful with this over-the-counter shenanigans. You know, it is not a shenanigan. It may help, but always seek medical professional way of getting things done. You know, very important. It's very important. Know when to seek medical attention. Yeah, man, if you are coming in right now and you don't know me, I am Dr. Ben, who is giving some medical tips here and there and talking to my friends. So if you are watching me, just know you are my friend now. You are my friend. Hit the like button and subscribe to the channel. What are you waiting for? Hit the like button, man. Dr. Ben, how are you all and all your subscribers doing today? We are fine. We are fine, and we are talking about medical tips of over-the-counter medication. Imagine, and someone is new to the channel and you have not subscribed. Subscribe to the channel. Really big up yourself. I can see you. And all that have not said hi, come to the chat and say hi, doc. Like Ridley, how are you doing today? The doctor will tell you, I am fine, my friend. I am very fine. I'm very fine. Do not rely on over-the-counter medication to treat any symptom or severe when it's worsening. Be careful. I've said you be careful. Why? It will turn out to be catastrophic. It will turn out to be catastrophic. Anyone who has not subscribed to the channel, you are missing a lot. You are missing a lot. So if you are a new person, please hit the subscription button and like as we go on. Know when to seek medical attention. Do not treat a disease with over-the-counter medication. Check the doctor because we don't want to escalate the problem. Know when to seek medical attention. Seek professional care when the symptoms such as chest pain, severe chest pain, your difficulty in breathing, loss of consciousness. When, first of all, loss of consciousness, you should not go over the counter. Go to a hospital immediately. Severe chest pain, difficulty in breathing, you are having difficulty in breathing. Why are you going? Difficulty with swallowing, sometimes you may use applesauce or take along with small amount of food. Yes, you know, before you have difficulty with swallowing, it should be a progressive thing. But there are some things when it comes to difficulty in breathing, in swallowing, most of the things that come out with difficulty in swallowing are always encapsulated progressively, not acute, like you have just started feeling the difficulty in swallowing. You see, persistent high fever. You have high fever, you are taking paracetamol, brufen, the fever is not getting down, you are struggling, you are, and fever, most of the time fevers don't come with sweating. Most of high temperatures in your body that are maintained, they come without sweating. They come without sweating. You are always having high temperature, fevers. Sometimes you have blood in vomit or stool or severe abdominal pain and you're just taking the medication. Go to a pharmacist. Tell the pharmacist that I need a referral, let me go. Ask a pharmacist or healthcare professional when unsure. When you are unsure of what you have, what you are facing, the pharmacist can help you choose appropriate over-the-counter medicine. And the pharmacist over-the-counter will explain the dose, duration, side effects, contraindication, and interaction. There are some people that they are affiliate of people that work in a hospital. Subordinate staffs, they have learned some 1, 2, 3 things in first aid. But you trust this person much than that person that is in the counter, professional pharmacist. So anything this person asks, tells you to take, you consider that person. That person that has apprentice learned from a hospital, but he's a cleaner. He's not a trained personnel. So anytime you ask this person, you go over the counter, you are given medicine, you ask that person. That person misguides you, you go home with wrong medication. That person that is on the counter is a trained personnel. Burnout is laughing. Yes, burnout. I have seen sometime you get some nurses who have done diploma or doctor's assistant. Some people trusting them much than trusting a doctor. Person that has gone 7 years, done pharmacokinetism, done dynamics, but you are being told to do this, the only thing you can consider is asking the other person. Be considerate, my friend. The training, and I usually tell people, when you are out there, and you are buying Mohan Kumar Aisa, and you are buying some drugs. How are you? I'm fine, Mohan. Be careful, because check. You can always read a qualified person and a person who is giving tricks. A person who is have a meal. Yes, as we talk, I'm having some tea. Some people who are giving tricks here and there to survive. You understand? Be careful with this kind of issues. So, always, the rule of getting over-the-counter medicine. Imagine we have gone over 20 points. Let me go through them. Ananda is back. Ananda, big up yourself. Mohan Kumar is here. Imagine we have said, read the medicine label, know the active ingredients, take the correct dosage, follow the correct frequency, do not exceed the maximum daily dose, check the expiry date, measure liquid medicine correctly, avoid duplicate medicine. Duplicate medicine is like what I've been explaining. You can rewind and see how I have explained the same compound but different companies. Yes, avoid duplicate medicine. Check for drugs interaction. How are they interacting? Thank you for the 100% for the love that people are giving. Thank you so much, everyone who is coming in. You see? You see, very important information here that we are following. Check that out. Very important information. Let's talk about, tell the pharmacist about the medicine you are taking so that you cannot have interactions. Consider allergies. If you have drug allergies, if you have food allergies, tell the person over the counter that you have this allergy. Be careful with alcohol, my people. Alcohol. Drowsiness, interaction, irritating, liver damage. Alcohol is not a good thing. Do not share your medicine. I've explained why you should not share your medicine. Keep medicine away from children. Keep medicine away from children. And why should you keep medicine away from children? Because some medicines are sweet. You may destroy, they may take an overdose and they may bring problems. You see? Keep medicine away from children. Store medicine correctly. Do not alter dosage forms randomly. You know you are supposed to take this dosage and then you are taking a lot than the normal dosage. Know when to seek medical attention. Ask a pharmacist or healthcare provider when unsure of what you are taking. You know, very important. These are very important facts, and you should consider each fact. You should consider each fact one by one. Right medicine, right person who is selling, not a quack. Right dosage, right time, right duration. Check warnings, seek help when necessary. These are very important tips that I'm sharing here, because I know some people always take medicine. You have been told that take 1 gram of this product within 24 or 8 hours. You take 2 grams of that product within 4 hours. Right dosage. Sometimes you don't, the symptoms are persisting and you are not getting to seek medical advice. My friend, seek always medical advice. You understand? It's very important to check all these things. So, anyone with any question before I leave? Anyone with any question, my friends? Who has any question? Or who can join the live with me? If you can join the live with me, join the live, let's talk. Who can join the live with me? Or ask a question before I leave. Then we have done 1 hour, 1 good hour, imagine. 1 good hour. Anyone with a question or anything to ask? Okay, I can see, or someone is still typing. Let me not just end. And someone is not. Some people, I have explained. Some people think more is better. Yes, I've tried to explain that thing. I've tried to explain that thing, man. So let's meet tomorrow to continue. Now we want to start to talk about prescription drugs. We talk about prescription drugs from tomorrow. Have a lovely time, and wherever you are, be blessed every time. Bye bye, guys. See you.